Hi everyone, welcome to today's session. If you've been following me on my Insta, you will realize that I did my first volunteer service with the OKU Central. Hi, with the OKU Vaccination Drive Central today. It was at Ara Damansara Saimdabi Plantation Building, and it was on the outside. So we braved through the heat, stormy winds, heavy rain. We got everybody vaccinated. So I'm so happy about that. We've got Dr. Priyanka joining us in just a bit to talk about everything that is from a dental perspective. Hi. We have a lot. I mean, I've got 4 kids, so dental issues is always going to be there, even in among adults. And I think going through all these problems or wondering what to do, should I go to my dentist? Should I do my 6 monthly regular checkups? What should I do? Should I see my dentist? Are they safe? Are these dentists vaccinated? There were so many questions that I had, and I thought the best would be just to get Dr. Priyanka, who's my family dentist, to actually join us and explain or clarify all these questions that I have. Let me just see if she's joined in, and I can just invite her. Give me a few minutes. Oops. And just a side note for those who joined me yesterday, because of all the Wi-Fi issues on Aisha's part, she's agreed. Hi Priyanka, I think I've sent you an invite. If you could just add yourself in, and we'll see you in a bit. So check out my latest stories, and you will see that we're going to have a live Zoom session. It's by registration only, but it's free. So join her. If you can't make it on Saturday, then I will see you. I will save it. We will save it live, and hang on. Yeah, so we will save it live, and it'll be on my YouTube channel. So YouTube channel is still Dr.RakheeYadav. So you can look up all the videos that I've done before this. Priyanka, if you could just click to join the live, then I could add you in. I've sent you the invite. Are you able to do that? Priyanka, are you able to join, send an invite for the live and see if you can? I've sent you an invite twice, so it doesn't allow me to send you one more time. Hang on. We'll need the latest version. It says you need the latest version of Instagram. I don't think you've updated the Instagram. Do you want to try that and see if Shashi can help you? It says, when I click to invite, it says you need the latest version of Instagram to join. Not sure what that means. So let me know how it goes. If you want me to close this and reopen back again, just update me, either one. So in the meantime, if anybody has any questions for Dr. Priyanka, you can always just ask in the DM itself. Okay, I'll see you as soon as you can. So as soon as you can join us, just join us. So while we're waiting for Dr. Priyanka, if there are any questions from a dental perspective, I've got quite a few lined up for her, so she's going to be able to answer all those questions for us. But if there are any other aspect of dental, be it from a child's perspective for your kids, or thanks, Shashi, from an adult perspective for yourself, for your parents, or anything like that, if you're worried about a root canal or I don't know, any other dental procedures, if you're worried about braces, oh yeah, that's something that we might want to look at. So about braces, and those who have braces, what do they do? Should you continue your follow-ups? Of course, I mean, being a doctor, I would definitely say continue your follow-ups. But if you have any questions at all, do let us know, and we can always just ask her as she joins us in a bit. So other than that, hang on. I'll just add her in, and you're able to. Hi.
Hello, I made
Hi,
it.
Dr. Priyanka. So I'm going to introduce you one more time. I've been blabbering away for the past few minutes.
Oh, okay.
This is my family dentist, my favorite family dentist, Dr. Priyanka Mahendru from Pristine Dental Empire. So that's in Empire Subang, the mall. And they're right next to Toys R Us, all right? So I love her. She's fantastic. I was terrified of dentists my whole life till I met her. So I'm so glad I'm not terrified to get my regular 6 monthly scaling and teeth checkups done. Um, okay, so I'm going to start off first before I get your questions answered. I'm going to start off with Dr. Priyanka. Could you just introduce yourself a little bit and let us know who you are, what you are?
Okay, so thank you everyone for joining our live chat, and thank you so much, Dr. Rakhees, for having me over. So I'm Priyanka, and I am a mom to a super active toddler and a wife to a super hungry husband. But I do have a day job, and that is I work as a general dentist at Pristine Dental at Empire Shopping Gallery. Yes, is what Dr. Rakhees said, very nicely located right next to Toys R Us. So any parents who come there, just come with, your husband's credit card. I'm sure your kids will go wildly crazy at Toys R Us. Yeah, so that's me.
Thank you so much for that introduction. So before I start with further questions on the dental aspect, have you gotten your COVID-19 vaccine?
I have actually. So I got both my Pfizer shots at KPJ. I think it was a super, super smooth experience starting from when I got the appointment date to their call reminder to actually getting the shot itself extremely smooth. So, and in fact, everyone in my clinic got it there, and everyone had only great stuff to say.
Excellent. How
I
was your
did.
experience after you got the vaccine?
Yeah, so I did develop like a mild sore throat and like a low grade fever after my first shot, and then I was perfectly fine after the second one. But the arm soreness was there, but it didn't really stop me from extracting people's teeth. Yeah.
I'm sure that doesn't stop any dentist.
Yeah.
I'm so happy you got your vaccine, and I remember at some point you were a bit worried about whether you're going to
Yes.
get your appointments, and when was that going to happen? When everybody started, all the so-called frontliners were getting vaccinated. I
Yes.
remember a lot of us in Selangor were really worried when we were put, I think, almost last in the schedule in March, April. But I'm so happy you got your vaccine, and
And in fact,
it's
if you
excellent that
remember,
you felt well.
you were my lucky charm. You remember? We were together, and you said, "Oh, check your phone." And I said, "Oh, I've been checking every day." You said, "Oh no, check it now." And true enough, you were
Yeah.
really my lucky charm because that was the day I got my appointment. Yeah.
I'm so happy for you. I'm so happy for you.
Thank
So I'm going to
you.
go to a few dental questions.
Sure.
I'm sure there are a lot. There's actually one question already in the comment, but I'm going to go with mine first.
Okay.
What are the types of dental cases that you've been seeing during the pandemic? Because a lot of us are having issues whether to go and see the dentist or not. So what are the cases that you've been seeing in the pandemic during these moments?
So I think what I've seen a lot more of lately is basically children with a lot more decays in dental cavities. And
Okay.
I think it's, I'm guessing all the kids have easy access to their fridges and their pantries that are probably loaded with sugary snacks. And, they get
Yeah.
bored easily, they tend to look for snacks. So
Yes.
so that's one. Number two, I've seen adults lately in this pandemic with a lot more cracked teeth and cracked fillings. Now,
Oh,
this is really interesting because the recent studies actually show that this whole work from home situation, in fact, a lot of people are working in a very non-ergonomical position, which is, lying down using their laptop, not using a good chair support, not, something with a poor back support. All that is actually causing them to have like a very poor posture. And
okay.
that is one, a bad posture. Number two, with, all of this unnecessary stress of the lockdown, plus, people losing jobs, unstable job situation, income situation is leading to stress. Now, both
Okay.
poor posture and stress is affecting their sleep. Now, poor
Okay.
sleep, all of the sleep disturbances is actually causing them to grind their teeth in the night. So the constant movement of
Oh,
their jaws, the constant clenching, the term is actually called bruxism. When that
oh.
happens, So basically unnecessary pressure on their jaws, on their teeth is resulting in cracked teeth and fillings. So I mean, in the last 1 year, I've attended loads of webinars and loads of red papers that have come out, just published in the past year, about patients who are having this because of this, wrong posture, poor sleep, and stress situation. Yeah.
Wow, wow, that
Yeah.
is wow, interesting. The dental caries part, I'm pretty sure some adults also would have it because I mean I've been eating on food since this lockdown. I mean I was quite good in the first two, but the third lockdown sort of like killed it with me. I'm trying to limit the amount of sweets and junk food that's in the house to my best, but there are some days, you get a bit weak and you do need to have a little bit here and there. So
Yeah.
excuse, right? But yeah, so a lot of dental caries. Bruxism is something, wow, I've not heard of that. So if anybody wants to look that up, it's Bruxism.
Correct.
Yeah,
Yeah.
bruxism. Right.
Yeah.
Okay. What about reduction in dental cases? Like, have you seen a reduction due, like in pediatrics, we see a huge reduction because kids are generally well these days. They don't
Yeah.
go to school, so they don't mix around. So are you
Yeah.
seeing less cases in terms of dental?
Definitely seeing a lot less number of patients. I mean, it's fair, I understand safety first, and people have a concern of coming out, especially because Pristine is in a mall, and there's
Yeah,
this whole under 12, kids not allowed rule as well. So
absolutely.
it does worry people. But personally, I have discouraged my very elderly patients and a lot of the very young ones to, take a rain check on their dental appointments. As much as a lot of my other patients have been using dental as a nice little outing for them, but I have
Yeah,
discouraged really the elder ones and the younger ones to stay at home. So personally, it
see them.
has affected the crowd, but safety first. So
Yes,
I
absolutely.
am taking it positively. Yeah.
Okay, and you said the below 12 not allowed. So that means they're not even allowed to enter the malls. Am I right? At some
So
point.
in actually couple weeks back, the mall was allowing, and then as of last week, if they didn't have a letter, so the clinic is based
Ah,
in Subang Jaya, right? So if a patient was coming from Subang, they were not you they didn't need a travel letter, but then they needed a letter for
okay.
the mall. So now
Okay,
the
to
clinic,
enter.
yes, to enter the mall because they do the
Ah,
check-in and the temperature scanning. So for that, even the under 10 km radius are needing a letter to just enter the mall.
okay. All right.
Yeah.
So once you get patients in, so I'm pretty sure you're still open throughout because I don't think you were closed at all throughout any of the lockdowns. Yeah, I remember I could get a hold of you anytime.
Yes, yes.
And so what SOPs have y'all put in place to ensure the safety for people who come for their dental checkups?
Okay, so we've got the full works for all of our staff, doctors, nurses, including the reception personnel. PPE is a must. So we're talking
Okay.
gowns, visors, caps, N95 masks, double masking, goggles, etc. But for
Okay.
the patients, it's again starts with temperature scanning, MySujatra check-in, health declaration, sanitization, disinfection. But what
Okay.
we're really reinforcing also is number one, staggering appointments so that we're not crowding different sort of families in the waiting area. So we're trying to
Absolutely.
limit
Okay.
one family and then having the other one wait outside. Um,
Ah,
yeah, and we're also disinfecting the entire waiting area once every patient leaves. So that as well really helps. Of course,
okay. Yeah.
we've got those Coway filters. So
Okay.
they detect aerosol in the air. So if it's too much aerosol, the entire thing turns red, and then we sort of delay the
Okay.
next patient from coming in until everything sort
Ah,
of settles down. Yeah.
is this some sort of air filter or a aerosol?
It is an air filter with the HEPA filter, but it does
Ah,
detect a lot of aerosol in the air. So that sort of
okay.
helps us to monitor and then keep sort of everything in check.
Okay. You're definitely gonna PM me the details of that
Yes, I
machine
will do
because me
that.
being OCD mom, yes, I need to find out what that is. So if I need to get it from my home, I've got air filters all over.
All
So
over.
I think
Yeah.
I definitely want to know a little bit more about that.
Yeah.
What about dental procedures? Are there any particular procedures that cannot be done during the pandemic or during the lockdown or during this COVID-19 uh,
So
issue?
the council had sort of implemented that, we stick to dental emergencies only,
Okay.
which is what was happening. But now that everyone is so much more familiar with SOPs in place in the clinic, taking precautions, that at the moment there are no restrictions. But personally, I
Okay.
feel that I personally do limit the amount of aerosol generating procedures. So all of the heavy
Okay.
scaling, too much of air polishing. I mean, I've completely stopped that because I feel that now that, COVID is airborne. Um,
Okay.
so we try and reduce all of the too much aerosol generating procedures and just stick to the
Okay.
basic things.
Okay.
But yeah,
And yeah, to your knowledge, are there any dental manifestations of COVID-19?
actually quite a few. WHO has actually put the ones that I'm going to talk about as additional symptoms of coronavirus. So number
Okay.
one, the first oral manifestation was actually dysgeusia, which is lack of loss of taste or
Okay.
impaired taste sensation. So um,
Okay.
that's one that I think most of the COVID-19 patients have had. There's also
Yes.
loss of smell. Um,
Okay.
but other than that, there have been things like a dry mouth, which is called xerostomia. There have been ulcers seen in a lot of COVID-19 patients. There's
Okay.
been bad breath, halitosis, everything sort of heightened because it is the virus that is in the body. So these are some of the manifestations. So you've got the basic ones, ulcers and gingival gum bleeding, that sort of thing, and then the really extreme ones, which is loss of taste and loss of smell.
Okay.
Yeah,
Right. All right.
yeah.
Okay. And do you have any tips on us on how we can ensure proper dental hygiene during these times? Because I'm like some of the elderly or some of even the younger ones, how do we maintain proper hygiene while we're waiting in that interim to come and see you to get our usual scaling
Okay,
done?
so definitely a good fluoride toothpaste, brushing and rinsing after every meal, and a mouthwash. In fact,
Okay.
for kids, I would say, or any parents who are listening, really just need to monitor their kids' sugar intake. All of that, sugar or the boredom that makes them want to reach out for a sugary snack, with parents who are working from home and having to, take care of work and a household, kids running all over the place. I can only imagine how fast one, gets a quick sugary snack from the fridge. But because,
Absolutely.
lack of monitoring, kids are having a very, very high and escalated rate of dental caries. So I would definitely encourage kids and adults to rinse and brush after every meal. Another
Okay.
thing very important is that we really need to keep our water intake up because all of this, poor water intake does lead to the bad bacteria in our mouth building up.
Okay.
And I think then the last thing I would stress upon is because we're all indoors, we are also lacking exposure to vitamin D, sunlight, which essentially is important for, our teeth and bones and muscles. So I would say probably getting some supplements,
Could you
to
maybe
keep
tell
that
us
up.
about flossing? How often should one floss?
Um, well, I would say every day. It's not an easy task for everyone to do. I do encourage my own
Okay.
patients to start with at least a couple of days a week, preferably after meals or in the night. It's just to,
Okay.
get in whatever little food deposits get stuck inside. I understand that patients find it very difficult to floss, for which I've
Yeah.
always recommended using a mouthwash to just sort of clear up, food debris, which
Okay.
it later on makes the flossing easier because you don't find things getting, stuck too deep inside the gum. Yeah.
Absolutely. And in what age should you start flossing?
I recommend by once a child is able to maneuver. In fact, actually, the youngest age could be 4 or 5 because they have now started making little floss picks. In fact,
Yes, I have
Lazada
those.
sells them.
Yeah.
They're really cute. They're little animal shapes, and they've got a little floss string stuck. So you just, you can engage them. And in fact, I always tell parents to do a little bit of modeling for them, for the kids, so they are able to see. Because number one risk of decay for kids is in between the teeth. So if the parent isn't able to
Absolutely.
floss for the child, the child can easily develop this habit of, standing in front of the mirror using those little floss picks to clean.
Okay,
Yeah.
and can I also add seeing your dentist and getting scaling done? And when your dentist shows you a nice polished teeth after the scaling, it helps because my eldest one did her scaling with Dr. Priyanka, I think a couple of months ago before the
Yeah.
MCO.
Yeah.
And since then, she's been flossing regularly. And she tells me herself that, Dr. Priyanka said we have to do this. And look at my teeth, Mama, it's so nice now. So I'm like, okay, so you also need a nice dentist to encourage your kids to floss and do the right thing. Sometimes coming from a third person, like if I
Mm.
say brush your teeth doesn't work as a mother, but sometimes when
Yeah.
a dentist or somebody else says it, the kid definitely goes like, oh, I'm listening to Dr. Priyanka. So all
Yeah.
my kids are following your advice, eating their apples a day, eating their
Thank
fruits,
you.
flossing their teeth. I've got one more side question.
Yeah.
I think there was a question in the comments just now about
Hmm.
discolored teeth. So someone who's not a smoker, has discolored yellowish sort of teeth, what can they do to improve that? It was one of the questions, but I think Babs.
Okay, so there's so many kinds of discoloration. If we're talking just the regular sort of staining from caffeine, coffee, tea, a quick air polish or even a regular polishing will clear up the stains. But if we're talking about discoloration, from maybe fillings that are leaking, or we're talking about, some genetic reason, or just a patient having slightly yellowish teeth, then a good whitening would help too. We've got loads of different kinds of whitening. You've got the ones you can do in the clinic, and you've got the ones you can do at home. So it's really case specific, but definitely I would say start off with something a little bit easy and simple, like a polish. And if you're not able to achieve the look that you're looking for, then I would say go in for a professional whitening.
Okay, what
Yeah.
about those toothbrush, the toothpaste, the one that says whiten your teeth in 2 weeks or something like that? Those work in a little bit or
So, I get this question so often. So,
yeah,
the answer is really yes and no. Yes,
okay.
because they do have whitening toothpaste do carry like a byproduct of peroxide. Peroxide is the agent that whitens, right? So technically, it does enhance the color of our teeth.
Okay.
And no, because it isn't the full peroxide. So there is no way that it can whiten as much as a
Uh-huh.
professional whitening can be done.
Okay.
But because it carries a byproduct of peroxide, it does help to clean off stains, which as a result gives, a whiter or a cleaner look. So
Okay.
yeah, I hope that answers, because it's really 50-50 here. I don't
Absolutely.
think they are advisable to be used long term. Um,
Okay.
but definitely something for a short term is good. Yeah.
Okay, and I've got another question in the comment. It's a generic question, but asking from experience and wondering if apple cider vinegar thins our tooth and makes it chip easily. That's a good question, actually.
So
A whole lot of us on apple cider to lose weight, so
yeah, actually,
very
a lot
calm
of
out.
a lot of people have told me this, that they've read on the internet that they taking apple cider on an empty stomach sort of helps them lose weight, but does it affect the teeth? Any sort of thing that has a like an acid level to it could potentially cause harm to the teeth for sure. It's that they used to say that, oh, if you take it with a straw it doesn't affect. I disagree, because it is the pH in the mouth that changes. So you were to take any sort of vinegar or acid, and the mouth the pH in the saliva becomes acidic, and that eventually causes breakdown of teeth. So yes, it can chip. Are we talking about taking 2 sips versus a glass a day? I mean, 2 sips, a couple sips don't harm. But if we're
Okay.
talking about taking a good amount daily, I would say not advisable.
Okay,
Yeah.
and we have another question from Babs89. Does having lemon in your daily water bottles, is it bad for teeth? Oh, that's a good question. Even I take lemon in my water bottle.
So
True.
actually lemon in the water is not bad because it's extremely diluted.
Okay.
So we are talking about, a lot of dilution, in a big
Okay.
bottle, 2 or 3 slices, I
All
think
right.
that's good.
Yeah.
Definitely no
Okay.
direct lime juice or lemon juice
Okay.
daily. That I would say will definitely affect. It actually thins our enamel slightly. Um,
Okay.
yeah, so as the enamel layer thins out, that is what causes our teeth to break down
That's it.
a
Okay.
lot more easily. Yeah,
Okay. And I've got one question from the pediatric aspect. So I get a
sure.
lot of patients who are, beginning to teeth and all that, and their teeth are starting to erupt. So the two questions is, one is, when do they start brushing their teeth with a toothpaste? And two is, at what point do they see a dentist?
Okay. So to answer your first question, when do they start using a toothpaste? Any child who has even one tooth is actually ready to use a non-fluoride toothpaste. So it is not
Okay.
safe for a child to use a fluoride toothpaste because they are not able to spit out. So even if your child is only 6 months old and you get an age-appropriate toothpaste that clearly says no fluoride, you just have to use a
Okay.
tiny little smear and you're good to go. For a
Okay.
child who's probably 8 or 10 months who has a tooth or two, I would recommend just a smear on a little tiny toothbrush and brush over it. Because although the toothpaste doesn't have fluoride, it does have everything else to strengthen that new tooth that's forming.
Okay.
Okay.
And
Your
when do they
second,
see a dentist?
yes.
Yep.
So I would say if your child is walking and able to sit by the age of 1 plus, that's when the American Pediatric Association recommends. I personally feel, I think 2.5 is a good age. I feel that when they're able to watch Peppa going to the dentist, that's a good time
Okay.
that they will really understand the entire experience. Because I feel that,
A good
a
tip.
two and a half year old is able to really enjoy Peppa Pig the cartoon. And to me, it's
Yes.
really about reenacting the entire episode for them on their first visit. So I think 2.5 is a good age for them to visit the dentist.
Excellent. That's a
Yeah.
that's a that's a nice good tip. When you can watch Peppa Pig going to the dentist. Yeah, I think that's a good age to go and see a dentist yourself.
Yes. Yeah.
I think you've answered most of whatever questions I have. Let me just check the comments to see if there are any other. I don't see any new questions. Right. Thank you so much. Oh
I
wait,
think
hang
there
on.
is one. Yeah.
I have
I
a friend.
see.
Yeah, I have a friend who has a wisdom tooth growing sideways. However, she can't afford fees for private dentists at the moment. How can she go about an appointment for government dentists in this MCO period? Would you know anything about that?
Okay, very good question. If your friend already has an X-ray, then they can actually directly call the Clinic Kesihatan to get an appointment. However, if this is not falling under an emergency case, and if your friend is not in any pain, they are going to probably give you an appointment for a very,
Absolutely.
very late date. Yes, they are not at the moment. The government clinics are not doing any elective procedures. So unless
Okay.
somebody is in pain, then they are able to see. But I think a referral letter, if you can get one, or I can help you, give a referral, that could probably work as well.
Okay.
Yeah.
So basically getting a referral, and unless I think most places now they're just doing a lot of emergency stuff, at least until the MCO dies down. So it'll be good to see how your friend is actually doing. And if it definitely is an emergency, I think
Yes.
shouldn't be a problem.
I mean, I can't
But
imagine if a
walking teeth,
wisdom tooth was causing pain,
yeah,
then they would definitely treat it. Yeah.
yes,
Yeah.
definitely. So if you need a referral letter, just go and see Dr. Priyanka and she'll get you sorted.
Yes.
I think, yeah, I think that's about it. There are no other questions. I'd like to thank you so much, Priyanka. I think this has been really good. I've got so many of my questions answered. And I hope everybody else got whatever questions that they have answered as well. If you do need to ask anything, you can always DM Pristine Dental. I will tag her in the profile after this,
Yeah.
her clinic as well. So if you need to go and see her, go ahead, make the appointment. And yeah, you're welcome. Kapila, thank you so much. Thanks a lot. Good and informative session. I hope this helped for your son as well. I've got so many parents who have small kids, so that's why I asked a few questions pertaining to a dentist aspect of it, because these are the regular questions I see a lot of mothers ask me
Yeah.
in
Yeah.
clinic as well. So thank you so much, Dr. Priyanka. I hope to see you soon for my scaling. I'm
Thank you
sorry I
so
defaulted.
much for having me. No worries. I mean, I definitely trust you to be taking good care of your teeth and your kids' teeth. So I'm not worried. It's okay for you to
Oh,
take a
thank
rain
you
check.
so much. See, they're all fine.
Yes, I can see those pearly whites.
Thank you so much once again. Thank you to your husband for sorting the Wi-Fi issue all out. So I'm
Yes.
so grateful to both of you all. And my lots of my love to your son. All
Thank you
right?
so much. We're due to see you soon too. So we'll get
Excellent.
that
Take
sorted.
care.
All right. Thank you so much for having
Take
me.
care. No
All right.
problem. Bye,
Okay.
everybody. Bye, Dr.
Bye-bye.
Priyanka.
Thanks.
Bye.
Bye.